A Bimini man charged with 2 counts of murder. More Cuban migrants found in Bahamian waters. And Grand Bahama a good candidate for fertility tourism.
The Bahamas Tonight Northern Edition starts now.
This is the Bahamas Tonight, the Northern Edition. Good evening all. I'm Shashina Rowe-Parkinson. As always, it is so great to have you with us. Topping news this evening: after a 2-year investigation, police hauled a man before the court this morning in Freeport to be charged with a double murder that occurred in the business district in February 2017. As Jamila Mizik tells us, the suspect is now on remand at the Bahamas Department of Corrections.
A South Bimini resident was formally charged before the magistrate's court on murder-related charges. Standing before Magistrate Debbie Ferguson, 33-year-old Terrence Roll was accused of 2 counts of murder. It is alleged that on Wednesday, February 1st, 2017, in Grand Bahama, Roll, being concerned with others by means of unlawful harm, did unlawfully and intentionally cause the death of Stephen LaFrance. It is alleged that on the same date, Roll also caused the death of Joseph Bain. According to reports, police were called to the scene outside of Game Time Bar and Lounge around 1 a.m. that morning after receiving reports of gunshots being fired in the area. On arrival, police met 2 young men suffering from apparent gunshot wounds. EMS personnel were called to the scene. However, one of the victims died on the scene and the other was transported to hospital where he died later. The 2 young men from Hunters were later identified as Stephen LaFrance, 24, and Joseph Bain Jr., a father of 4, both employed at Roofing Expert. LaFrance was shot in the head and Bain in the chest. The deaths were classified as the island's first and second homicides for 2017. In court Monday morning, Roll was not required to enter a plea and bail was denied. However, he can apply to the Supreme Court for bail. Roll was remanded to the Bahamas Department of Corrections for service of voluntary bill of indictment and is expected to return to court on June 24th. Jamila Mizik, ZNS Network News.
Meantime, the Doyle Mackey murder trial is expected to resume in the Supreme Court tomorrow. Doyle Mackey is facing 2 counts of murder and 3 counts of attempted murder. He is accused of the shooting death of 22-year-old Carlton Hamilton of Colony Club Freeport and 24-year-old Carlos Hamilton, aka Don Carlos of Murchison Drive, Freeport. The Hamilton brothers were gunned down in a remote area near the McLeanstown graveyard in East End. Tremaine Ferguson, Joshua Williams, and John Edgecombe were also shot during that incident. Mackey is represented by attorney Carlton Sherland, and Justice Estelle Gray Evans is presiding. More Cubans rescued in Bahamian waters. Around noon yesterday, the U.S. CG cutter Robert Yaird made a stop at the Freeport harbor and handed over 9 Cuban migrants to immigration officers. Reports are that at 4 p.m. on Saturday, the migrants, who are all adult males, were initially observed by USGC aircraft on Kesal Island in Bahamian waters. However, upon seeing the aircraft, the men ran into the bushes. The RBDF was notified, who in turn requested the USCG to assist and granted permission consistent with the United States and Bahamas Comprehensive Maritime Agreement for a USCG cutter to enter and investigate the sighting. Later on Friday evening, a USCG team went ashore on Kesal Island and located 9 adult males who all claimed to be Cuban nationals. A rustic 18-foot wooden sailboat with a white sail was nearby on the shore, which is believed to have been the means by which the migrants departed Cuba. The Cuban migrants claimed that they departed Cuba as a group earlier Friday in a rustic sailboat destined for the United States. After taking custody of the migrants, immigration officials transported them to immigration headquarters to be processed further and to be examined by the medical staff of the Disease and Surveillance Unit of the PHA. The Immigration Department intends to fly the Cuban migrants to Nassau today to be detained at the detention center until repatriated to Cuba. This brings a total of 50 migrants who were turned over by USCG to the Immigration Department Freeport for processing within the past 14 days alone. More details coming in tonight on the proposed national health insurance. Chairman of the NHIA shares what role doctors and insurance companies will play in the grand scheme of this national health insurance plan. Chairman of the National Health Insurance Authority, Dr. Robin Roberts, says the sustainability of national health insurance can only happen through pooling funds, bettering public sector facilities, private-public partnerships, and reasonable insurance rates. He shares how the doctors are now buying into this concept.
We've seen it working already. We have this system in our primary care where we talk about capitation. And we said to the doctors, we would like for you to provide primary care and primary health care for our patients. All we're going to pay you, or all we can afford to pay you, is $150 a year, no matter how many times you see the patient. They look and laugh. You got to be kidding. That's $12 a month. And then I say, but suppose I send you 1,000 patients. Equation changed then. I'm now looking at making $150,000 a year, prepaid. And so it's not surprising in the beginning, they never listened. But now today, okay? And nowadays, we got them knocking on the door. You know, can I join the program?
Employers will now be mandated to ensure that employees have health insurance. Dr. Roberts says each person's coverage will cost $1,000 annually, which is around $84 a month. These businesses will be permitted to recoup up to 1.5% of an employee's full wages to share in that cost premium. He shares how the government intends to work with insurance companies.
Premiums today are based on what we call experience-based rating. So in other words, if you had an illness before, I got to charge you more because you're more likely to get ill again, especially if you have a pre-existing condition. So what we are saying is, listen, everybody is making a contribution. If everybody is making a contribution, then our rates should drop significantly. And what we're going to do is that I'm going to say to the insurance company, that I want you to be a part and sell my premium, that same employee based premium that we were talking about, because they coming to you. You're going to have greater number of volumes. But here's the deal. Number one, there'll be no experience-based rating. In other words, you cannot deny them care or charge them more because they had a prior existing condition or because they're 80 years old.
And that's not all.
When they come for these services that we consider in our standard benefit package, there will be no deductibles, there will be no co-pay, and there will be no co-insurance. Because we do not want to have any financial hardships. We are having a prepaid plan. I think they're buying into it. Because we are saying at the end of the day, we're giving you the whole population to look after. And so we're going to spread the risk. So we're going to have what is called community-based rating. And so for our $1,000 a year, everybody is going to pay $84 a month for the service that we have. So we're going to regulate the cost of what our providers and our insurance coverage should have.
And still on the health beat, a local doctor is advising the concept of fertility tourism. Infertility is becoming a condition for some women now, and local doctors believe Grand Bahama has what it takes to tap into this niche market. Megan Shepard explains.
In 2010, the World Health Organization reported that 48.2 million couples were affected by infertility issues. Family medicine practitioner Dr. Kevin Bethel notes that treatment for infertility issues could range from simple changes in diet and lifestyle to more advanced measures such as surgical. As governments have discussed capitalizing on medical tourism in the past, Dr. Bethel notes that the Bahamas has a prime opportunity to take advantage of our prime location and environment.
The Bahamas has a golden opportunity to jump on board with medical tourism with fertility. You know, I often point out that if you think about it, how many even Bahamians were conceived on vacations when their parents went on a vacation, right? So it works, we are a destination, vacation destination. So if you want to think about how many people in this world were conceived in the Bahamas when their parents came up to the Bahamas on a vacation, there's a lot. So we're already in the game. So why not augment that? Why not accentuate the, you know, have destination packages that are specifically geared to help couples relax, get into the mood, you know, maybe, you know, get some counseling on the nutrition and all the other things I've already talked about to help the whole process happen.
When it comes to the surgical aspect of dealing with infertility, such as in vitro fertilization and egg donations, Bethel says that the Bahamas could take this industry to the next level. He adds that facilities should focus on providing safe and effective treatment, but at a lower cost.
As far as I know, there's nobody doing things like, you know, assisted fertility where you're doing the so-called test tube babies and stuff like that. There's no reason that we couldn't. Again, it's an opportunity that I think that we can tap into. There's certainly enough Bahamians, right, that would utilize the service, but there's certainly an extended world market that could definitely make it much more affordable through the volume of people that we would have.
He adds that infertility is big business, and opening facilities in the Bahamas could provide more opportunities for Bahamian doctors as well.
Because if a team is getting really good results at a particular hospital or institution, sometimes another hospital will offer them more money, but they want the whole team to come. So that includes all the different doctors, nurses, and counselors, and everything, right? We had seen this before, even when I was in training, that the infertility team actually got stolen away, literally, by another hospital system. And so in other words, it's big business.
Megan Shepard, ZNS Network News.
Stay with us, there's more news coming up right after the break.